In chiropractic practice, professional liability extends far beyond clinical outcomes. A single lapse in judgment can jeopardize your career, your reputation, and your insurance coverage. Welcome to Briefcase, an OUM series that examines real malpractice claims involving chiropractors. Each case offers practical insight into the risks practitioners face and the steps that protect both patients and practices. In this case, a patient alleged the insured took a nude photograph of her without her knowledge during an appointment. The patient was a 44-year-old single female athlete. She presented with bilateral knee pain. The insured referred her to an orthopedic surgeon for imaging. She did not see the surgeon. Instead, she returned to the insured 6 times over the next 15 months. At each visit, the insured repeated his recommendation to see the orthopedic surgeon. She eventually followed up and underwent arthroscopic procedures on both knees. The patient continued chiropractic care with the insured for the next 8 years. She received treatment for pain in her knees, thoracic spine, right thigh, hamstring, lumbar spine, and right shoulder. Treatment consisted primarily of myofascial release and electrical stimulation. According to the patient, she presented to the office and asked the insured if he would take a picture of her in a yoga position. The insured agreed and left the room to retrieve his phone. When he returned, he found the patient completely nude in a yoga position. He took the photograph. The patient then dressed and received treatment for shoulder pain. She continued to visit the practice and referred others for care. A year later, the insured's wife discovered the photograph on her husband's phone. She contacted the patient and told her not to return to the office. The patient then filed a police report alleging an unauthorized nude photograph had been taken. The patient hired an attorney and filed a lawsuit. Allegations included failure to adhere to the standard of care, improper touching, failure to enforce supervision, harmful and offensive contact, reckless disregard of highly offensive conduct, and breach of fiduciary duty. The defense reviewed the police report and medical records. The insured stated the patient had discussed her recent surgery and weight loss and asked him to photograph her post-surgery appearance. He took the photo on the examination table with her back arched. He sent the photo to the patient's phone and deleted it from his own. The patient later admitted she had been nude in the office on multiple occasions. No criminal charges were filed. A reviewing chiropractor opined that the clinical treatment was appropriate and within the standard of care. However, the photograph was not part of the provision of chiropractic services. While no evidence supported inappropriate touching, there was a clear lapse in ethical judgment. Coverage for the claim was excluded from the insured's professional liability policy. The insured paid a confidential sum to resolve the case personally. This case underscores how quickly professional boundaries can erode and how serious the consequences become when they do. Documented evidence of unethical conduct placed the insured's coverage and personal assets at risk. Clear chaperone policies, careful clinical judgment, and strict adherence to ethical guidelines protect both the patient and the practice. To learn more about reducing your risk, safeguarding your practice, and to download the full case, visit OUMChiropractor.com.